All right, good afternoon, everyone. We're going to start our session here. So if you'd like to have a seat. Hope you enjoyed the delicious lunch, and I would absolutely come back to the Lowe's Hotel. They've done an outstanding job, I think. So if you're... When you have a chance to provide some feedback, if you want to give that feedback, we'd appreciate it. So I am Bob Cruckton. I'm a member of the ABTA Board of Directors. I've been involved as a volunteer since 1998, so half of the time of the ABTA. Got involved when my friend Paul was going through a 10-year-long GBM battle, and it really has been a life-changing experience being part of the ABTA, and I'm sure you all feel the same way. So thank you for being here. Without further ado, our session this afternoon is involving holistic care for brain tumor patients. I want to have a big round of applause. I want to introduce Dr. Roy Strowd. He's the Associate Professor and also the Vice Dean for Medical Education at Wake Forest University School of Medicine. So without further ado or delay, Dr. Strowd.
Thank you. It is great to be here. Thank you all for being here, for attending this session, for attending this event. It has been inspiring as a physician and a provider and a neuro-oncologist to be here over the last 2 days and have a discussion with you. Technically, I think I'm the speaker for this session, but I hope to do a lot of listening and discussing. And so I would really ask you to raise your hand, to pause us as we go through and ask your questions. That's why you're here, and would love to engage you in a discussion of that. We will have time at the end for Q&A, but let's not wait for that. So if there's something I'm talking about as we go through that you want to ask a question about, just raise your hand and we can digress and then sort of get back into what we're talking about. There's 3 things I wanted to do with today's discussion. One is just to define what holistic care is, and really to normalize that. That's something that we as providers, as patients, as caregivers, this is really what we're doing all along, and the goal is. You know, the way medical education works, I also wear the medical education hat. You spend the first 2 years of med school learning all the science of medicine, how the body works, how it works when it's working correctly, and then what happens when things go wrong. And then you go into the clinical clerkships, the clinical environment, and you rotate through all the areas, OBGYN, pediatrics, surgery, medicine, those sorts of things, and sort of pick what you want to do. And for me, the cancer center was the most inspiring place to be. It's where your job, and you saw this in Dr. Dunbar's chart this morning, your job is to take care of the whole person. That's the person and their family and their caregivers. That's their physical health, their mental health, and their well-being. And that's really something that the providers you see, that's why they get up and come into the clinic. And that's what we'll talk about. So we'll spend the first kind of few minutes just talking about, well, what is holistic care? How do we think about that? The second is we'll talk about a few common topics. So I'm going to bring some expertise and experience. I've done a few webinars on this. We've done some clinical trials on some of the things related to exercise, diet, and kind of nutrients and supplements and those sorts of things. So we'll talk about some of the data and some of the experience with things like exercise, with things like nutrition, and then other complementary approaches to care, yoga, meditation, massage, acupuncture, those sorts of things. I am not a dietitian. I am not an acupuncturist. I am not a yoga instructor. And so I'll bring the lens of a physician who is passionate about working with a large multidisciplinary team to provide those for patients and give you a window into kind of what I think about, and would love to hear your thoughts on that. And then at the end, I'll go through some common questions that come up for me as a provider, that questions asked that patients want to know, that caregivers are thinking about, and would love to hear your questions as we go. So please stop me and let's pause and do that along the way, but that's where we're headed. So I don't have any disclosures, except I'm not a person who does most of the things that we'll talk about. I spend my day seeing patients and sitting across the bed or the clinic from those patients and teaming with them to figure out how we can do what's important to them. And what you will hear, hopefully threaded through this talk, is that what's most important for the provider in front of you is hearing what your goals and values are. And really understanding that, you bringing that, helps us to help you to make that happen. And so that's a key kind of take-home point from today that we'll try and thread in. The objectives are to normalize holistic medicine. What is it? What do we mean? There's a lot of things that fall under this bucket. So what do we mean when we say holistic medicine? We'll talk specifically about what we mean when we say nutrition, exercise, and wellness. And then this third point I think is almost the most critical: when to do what, and what to ask when. And a lot of the things that we'll talk about, there may be a time during treatment where it is optimal and a time during treatment where it is less optimal, where we don't want to do that. And so we'll think about how to incorporate this into the epics of care, the continuum of brain tumor care. Make sense? All right, so normalizing holistic medicine. Let's start with just some definitions. What do we mean when we say holistic medicine? You'll hear some of these terms used: complementary medicine, alternative medicine, integrative medicine, and holistic medicine. I'm actually going to read these because I think it's helpful to just have an idea of what each of these means. So complementary therapy, a complementary therapy means that you can use it alongside conventional medical treatments, chemo, radiation, surgery, those sorts of things. And it may help you feel better and cope better with your tumor and treatment. And a lot of the things we're going to talk about today are complementary approaches. How do you integrate them into the care that you are receiving? And we'll talk about how to think about that. And alternative therapy is generally used instead of conventional medical therapy. So instead of the chemotherapy, or instead of this, that, or the other, we're going to use this approach, or we're going to take that approach. And that would be an alternative therapy. You'll hear that term used. Integrated therapy is generally used to describe the use of conventional medicine and complementary therapies together. And that's really where we want to move a lot of the discussion today, is how do you integrate the things that are important to you: yoga, meditation, massage, acupuncture, physical activity, mental well-being, connection with patients or with families and loved ones into your conventional treatment. Holistic medicine is a form of treatment that is directed at the whole person, that total person, total patient care that you heard from Dr. Dunbar, including body, mind, spirit, and emotional well-being. And we'll touch on that at the end. So this is how I like to think of the goals of care. What's the purpose? Why are you showing up to see your provider, and why is the provider showing up to work with you? And at the center is the patient, most critical. And that's really where we're going to focus today, is patient-centered care. And there tend to be three goals, or three things that are in my mind as I'm meeting with patients. One is we have a lot of tools to treat the tumor. And that is one, but not the only goal. And we'll talk about some of those things that you're aware of and may have experienced. Our second goal is to minimize side effects. And there's other tools and strategies that we can use to minimize side effects. And third is enhance quality of life and function. And as we talk and think about some of these complementary and integrative approaches to care, it's important to know whether we're using that to treat the tumor, or whether we're using that to minimize side effects, or are we trying to enhance quality of life and function. And we may use a nutritional supplement, we may use exercise, we may use diet for different things, and knowing with your provider what the purpose is can be really helpful. And it can be helpful to have that discussion around how to integrate it into your care. Here are some of the tools that you know that we have to treat the tumor: surgery, laser therapy. The laser therapy booth is here to talk a little bit more about that. Radiation, chemotherapy, targeted treatments, and immunotherapy. And so those are some of the data-driven ways to treat the tumor. Integrative medicine may have some effects on the tumor, but we want to think about how we incorporate that tool into the existing tools that exist to treat the tumor. How do we minimize side effects? Sometimes we adjust the dose. We use anti-nausea medicines that we heard a little bit about this morning, corticosteroids, bowel regimens. Adjusting diet can be a very effective way to minimize side effects. That's where diet can be particularly helpful, avoiding sun exposure and other sorts of things. So we approach minimizing side effects differently than treating the tumor. And then we talked this morning about some things that can be used to enhance quality of life: sleep, exercise, changes in driving, job, purpose, and kind of meaning. And so some of the things that we'll talk about will actually fall into this enhancing quality of life. How do we use this therapy alongside tumor-directed therapy, alongside minimizing side effects, to enhance quality of life? And understanding the purpose of the tool that we're using, the treatment that we're delivering, can be really helpful for understanding how to integrate it holistically into all of the things that we're doing for you and you're doing for yourself. And this is a really important slide, because this is kind of how we, or providers, think about all of the treatments, the therapies, the holistic approaches to care that we think about, and it's this benefit and risk. And in general, in clinical medicine, things that are really high in benefit and really low in risk make great sense, and we want to move forward with those. And that doesn't take a lot of discussion to do. If it's really going to help and it's not going to hurt, let's do that. Things that are high likelihood of benefit and high risk require a lot of discussion around what is the benefit to you as the patient. That's individualizing the care to you. When there's not known benefit, it's unknown whether this will benefit the patient or not, and there's a potential for high risk, that's not something we want to do. And that's where you're looking for counsel and advice from the provider to say, this is something that is not the right time to do this. This is low likelihood of benefit. It's not going to, may not help you, unlikely to help you, and there's a high chance of harm. When we don't know if it's going to work, unknown benefit, but it's probably not going to hurt, then the next question is it right for you? Is it a valuable thing for you? Is this a part of your goals of care? And if that's the case, we want to pursue it. But sometimes the question for me goes back to the patient, is this important within your care? Does this fit into your life? Is this of value? And so this is one way we think about integrating a complementary and alternative approaches to care. So those are just three overarching principles that we'll thread into today's session. And then the last thing I'll touch on, just overarching, how to ensure a holistic approach for me. You know, how do you do this? I heard this in the session this morning and with conversations with some of you, is my provider just isn't interested in talking about that. I ask these questions and bring these questions, and I hear crickets. Or you can't do that. We're not able to do that therapy. And so I think the three things that I would advise in this situation, first is communication across the whole team. You want your surgeon, your radiation oncologist, your neuro-oncologist, your neuropsychologist, your palliative care physician, anyone on that team to understand what's important to you. What do you value? Why are you there? What are your goals? For some patients, living longer is the goal, and that's the most important thing. For some patients and in some stages of care, the quality of your life is the most important thing. Sometimes it's the son's graduation or the daughter's important life event or whatever is going on. And those goals are important to communicate across your whole team so they can bring that holistic approach to your care. Advocate for self. What is important to me? It's really helpful when your provider understands what's valuable, what you need, and really can understand. Sometimes we are trained to ask those questions, but sometimes we just don't bring that into the visit for some a reason or shape or form, and that can be very helpful. And then who can I talk to that will help me to better understand this? That's a really important question that I hope we can arm you with. I love hearing this from my patients, is it can be difficult to answer, what do you know about the ketogenic diet for treating brain tumors, if you haven't done a study on ketogenic diets for brain tumors. But it can be a lot easier, a lot more helpful to answer, who can I talk to help me better understand about how I could use a ketogenic diet in my care? Who could help me understand how diet or lifestyle would help me to cope and manage some of the side effects that I'm dealing with? I'm having a lot of nausea. Who can I talk with who can help me to understand and help me with the nausea that I'm having? That gets your provider thinking a little bit differently about their job. Their job is to put that team together to help you with the needs that you have, and that question can be very empowering for you and your provider as a team. So just some introduction, kind of normalizing holistic care. How does your provider bring in holistic care into your treatment? Now let's get into the details. Let's talk about nutrition, exercise, and wellness, and some of the data that exists and the experience that providers have around these. And we'll talk about what do we mean when we say nutrition, when we say exercise and wellness. First, let's talk about nutrition. And I love this slide, kind of we are what we eat. All those old adages are really based and founded in some truth in there. What your grandma told you was right on, right? So we are what we eat. Turns out it's true. And the gut and the brain are intimately connected. And I love some of the comments on this slide, and we learn about these in medical school and kind of basic training. So production and expression of neurotransmitters is mediated by all of the food that you are putting into your gut. Those calories and carbs and protein and fat, those things that you are eating actually changes the neurons and what the neurons say to your brain and the neurotransmitters that exist. You're changing the chemical communication that's occurring in the brain by what is going into the gut. There are changes in hormonal production, in enteric immune regulation, the way your immune system works based on how active and the way that your gut is active. So the gut is talking to the brain at all time. That's why you're tired right now and everyone's sort of drifting. It's why we tried to do the shuffle, and Minnie did it phenomenally well. I was not up there. I apologize. Would have embarrassed myself and just about everyone else, right? But it's talking to your brain right now. In addition, the brain is always talking to the gut. And there are a number of nerves, these automatic nerves, that are constantly signaling to the gut and telling it what to do. That's why when my 12-year-old sits down, she's like starving. She's not really starving, but her brain is telling her she's hungry when she wants that last extra something or this, right? That's the brain telling the gut kind of how to think and act. And we can modulate that and adjust and change that with the way that we think with our minds, and kind of it affects our gut. And then the gut microbiota, the bacteria that normally live within the gut, control a number of these processes. And so, we are what we eat. It actually is true. There's an intimate connection between the two. Whether what we eat treats our brain tumor is a different conversation, and we'll talk about some of the data there. But things like side effects, minimizing side effects, well-being, and your overall health are intimately connected to your diet. So one important question that I want to address today is whether nutrition is really a brain treatment or a brain tumor treatment or a mind treatment and a wellness and kind of whole person care treatment. And we'll talk about some of the data of whether diet can be used and how it can be used to treat the tumor, and how diet can be used to minimize side effects and maximize your quality of life. I love this slide. If you did want to take a picture of a slide, take a picture of this one and focus on the color. Because when I talk to dietitians, what dietitians generally will tell you and tell me is that the more color in that diet, the better it is, right? That's driving that constant communication between gut and brain, and really to help. And we can look at some of the things that fall into each of these categories, and you can look on the plate to see how colorful that plate is in front of you. So kudos to Lowe's Hotel, because it was a pretty colorful lunch, and that in general is the diet that you are looking for your brain tumor care. So when patients come in and they sit down for that first visit with me and say, what should I be doing with the diet? Ketogenic diet, changing everything that I do, going to fasting. A lot of times I'm pushing the brakes and saying, nope, do the exact same thing that you've been doing, but let's find a way to add a little bit of color into that diet, a little bit of color onto the plate. And that is probably the best way to start, and for many patients may be the right way to end, with integrating dietary therapy into your care. But for some patients, that's not enough, right? I really want to pursue diet, and so let's talk about what about dietary and nutritional therapies, and how can these be used to treat the tumor? There has been a lot of interest over time in utilizing diet to treat the tumor, to influence the biology of tumors, and a lot of this goes back to an effect called the Warburg effect. And this is a complicated principle. It can be broken down pretty easily. Everything lives on sugar, and so do cancers. And we use this in the cancer center all the time with a PET scan. This is a PET scan looking at a lung cancer. And this patient took a sugar-containing solution. It went all throughout their body, and there's a lot of sugar, a lot of signal where this lung cancer is, because the tumor is actively utilizing that sugar to grow. And cancer patients all throughout the hospital, we use PET scans to image and evaluate their tumors. We don't use this for brain tumors, because the brain is one of the most metabolically active organs in the body. It's also taking up all that sugar. So if we turned the camera for this PET scan up, we would see the brain lights up very hot as well. So PET scans aren't a good way to look for brain tumors, because the brain is one of the most active, sugar-avid, sugar-active organs in the body. Similarly, brain tumors take up a lot of sugar, and they're living in that milieu of the brain. And so there has been a lot of question about whether diets can be used to treat brain tumors. And as you read, you will see a number of diets. There's our standard diet, whatever that is, ketogenic diets, modified Atkins diet, intermittent fasting, the Mediterranean diet, and we could go on with diets that have been pursued and evaluated for treating the tumor and addressing this sugar avidity, this interest in sugar for cancer. I'm going to focus on the ketogenic diet and talk about specific data for that, but if you want to digress and talk about intermittent fasting, we can talk about fasting or the modified Atkins diet or those sorts of things. Ketogenic diets, this is where there's often the most interest, is a high-fat, moderate protein, low carbohydrate diet that avoids sugar. This is not just stopping the cookie at the end of the day or that piece of cheesecake that was really good after lunch. This is a dramatic transition in every piece of food that you put into your body. It often is accompanied with carb counting so that you're accountable to and understanding the food that is taken in. There is some, but not enough evidence to support the use of ketogenic diets for brain tumors. So I think that's really important. I'm going to walk you through some of the data. There's a lot of interest in ketogenic diets and diets for brain tumors, but we're not at a place where we are clearly able to say that that works for treating your brain tumor. But there is a number of evidence to say, a lot of evidence to say that it can be used to treat seizures, that it does modulate weight. Patients lose weight on a ketogenic diet, that it can be incorporated into the overall treatment plan as long as we are intentional about when and where to do it. And it requires a significant amount of desire and a ton of family support. This is often a whole family approach to treatment and not just the individual patient. And it's not for everyone. So this is one study that I'll talk to you about. We ran this study a few years ago looking at a ketogenic diet for treating brain tumors, and I think there's some lessons to be learned from this. So it was, we looked at the glioma-Atkins-based diet. We call it the GLAD diet. It's a little bit better than the MAD diet, which is the modified Atkins diet. Modified Atkins is a little bit of an easier way to do keto for adults, and that has been borne out in seizure patients. And we also incorporated intermittent fasting. So over the course of a 7-day week, patients did 5 days of the modified Atkins diet, which is a very, very low carbohydrate diet, and interspersed with 2 days of intermittent fasting. And the goal was to flip a switch in the tumor and the tumor environment and see if we could change the way the brain was working, that sugar avidity, that sugar interest. And there's a few things that were learned. First, we screened 116 patients, and only 21 were able to complete the study. This type of dietary therapy is not for every patient. And in general, how we got from 116 to 21 is the 21 patients who really were interested in incorporating this into their life, even before the tumor had been found, and they were in the cancer center. So that's the first lesson. It can be a very well tolerated therapy for those who are interested, but it is not an easy thing to do. The second is patients got this fancy MRI scan. It's called an MR spectroscopy, and it looks at what's going on in the brain. And the goal was to see whether we could change the tumor in the brain as a result of this diet, and I'll show you that in the next slide. So the two lessons to be learned there is first is this ketogenic diet does change the way the body works. And here we're looking at ketones. This is ketones, which is a marker of whether the diet is working in the body. And there were no ketones in the body at the beginning of this study, at the beginning of this 8-week treatment. And there were a lot of ketones on this gray at the end of the study. So this changes the way the whole body is working, not just the brain. And it can increase nausea. It can also decrease nausea. It can increase fatigue or also decrease fatigue. And I'll talk a little bit about some of those side effects. The second is, what does it do to the brain? It does two things. One is those ketones also get into the brain, so it's changing the way the brain is talking to itself. That's how it treats seizures. And the second, it's reducing the amount of sugar that's in the tumor. So we did see both of those things. What we don't know is whether the tumors shrink or the tumors respond, or it influences the outcomes for patients. And that's just something we don't know today. I will tell you the patients that were on this study had a lot less fatigue. And towards the end of the day, there was more mental clarity that patients reported on this. But this was not something easy to incorporate into standard care as the patients were going through it. So this is a diet that we started at the end of chemotherapy treatment after patients had completed that conventional treatment, and that seemed like the most opportune time to integrate this therapy into the care of patients. So it kind of gets back to that point of these are options that are out there for you and for patients with brain tumors, and identifying the right time to integrate them is important. Questions about diets or nutrition or those sorts of things that anyone wants to just kick us off with? Yes.
So just want to clarify, the sugars you're talking about are processed sugars, because I do a vegan diet, which involves apples, whole apples, and things like that. If you could just kind of go into details about sugar, fat, or sugar from fruits and other foods.
It's a great question. So the ketogenic diets are any type of sugar. Simple sugars, complex sugars, and anything in between. And so that's where those diets really are a substantial shift in really all substances, macronutrients, the kind of sugars, fats, and proteins, and also micronutrients that are going into the body. So you would be surprised at how at the sugar content of some medications and other things that are put into the body. And so this is really a comprehensive evaluation and shift in all of those things. I think this is a great point, though, is that there's a lot of things that can be done to improve how you feel as a person and how you are doing as a patient that isn't the ketogenic diet. And sometimes that shift from that simple sugar to kind of more complex sugars is a good way to do that. There's a lot of sugar in fruit. Fruit is one of those colorful foods. It's absolutely something great to put on the plate, and it doesn't need to be through a kind of a complex ketogenic diet. There was one question over here.
Well, I was just wondering, do you still do this study? Do you take participants who are interested in finding out if this could help someone?
So this study is closed, and I'm not aware of a current ketogenic study that is open and enrolling to answer some of these questions. There have been somewhere in the order of 16 to 20 clinical trials looking at what does this do for tumors. And to date, there's just not been a study that's shown the ability to shrink tumors and treat tumors and really adjust the biology of the tumor with these type of diets. There's a lot of interest in doing that, and there still may be a place that it can be incorporated into care, but that's not where we stand today. And this is where I think diet really can be most effective in minimizing side effects and maximizing quality of life. We just don't know yet what it is doing to the tumor.
But you said this study was 8 weeks, is that correct? And what was the length of other studies that was done?
This study was 8 weeks. Patients were able to continue the diet up to 6 months afterwards, and about 80% of patients continued some component of the diet. We use this diet because this is used in adult patients with epilepsy for years, and they're able to incorporate that into their lifelong without side effects or challenges. There are other studies that have been done looking at 6 weeks just during radiation therapy. There's a lot of difficulty in integrating a diet into radiation therapy and sort of combinatorial side effects or toxicities from both of those that can be difficult for patients to get through. There are a few studies that have tried to do this in a more prolonged fashion for patients. It's been very difficult to integrate in. But that's that 116 to 21. In patients where this is really important for their life and they are interested in pursuing this and have the support to do this, these diets can be continued for a long term and done safely, but it must be under the counsel of a dietitian. That's very, very important for these type of shifts in macronutrients. Other questions or comments? Yes?
Were they, excuse me, on that study, were they thinking about any kind of chronic condition besides the tumor? Because I have type 2 diabetes now, and then I still have part of it's a more aggressive meningioma in my head. It's in the right cavernous sinus. And so I wonder, has anyone considered that with diet that you should be on as far as how that affects the brain and or the other direction? And also with having any kind of brain tumor.
It's a great question because diet affects all of those medical conditions, and medical conditions is all those things influence the optimal diet. So for this study, patients with diabetes were excluded from the study for concerns for kind of overlap with the diabetes and diabetes treatment and this massive shift in carbohydrates. And that is true for some ketogenic studies, as well as other studies looking at treatments targeting the metabolism of the tumor. And this is important. This is why one of those initial questions is sort of bringing those conditions and those questions to your provider. You know, this is who I am. These are my medical conditions. I'm interested in looking at a dietary therapy that we could integrate into my care. What type of dietary therapy is safe for me? What type of dietary therapy could potentially help with my tumor or symptoms or quality of life and not interfere with other things going on? And diabetes is an important one to raise because diet is really important in the management of diabetes. That's a great question. Okay, thank you for your questions. Great questions and discussion. We'll have some time as we continue to go through to talk, to answer other questions and address other comments you have. So let's briefly talk about exercise. And I'm going to go over a little bit less data with exercise, but try and hit some of the key high points related to this. And I think we could ask the same question, you know, what's exercise for? Is exercise treating the neurons, the brain tumor, or the nerves? My mood, anxiety, the stress of going through this, my mental well-being, and there may be differences in the influence of exercise on the physical properties of the brain and your overall and our overall wellness as patients and as people. So if you could take anything away from the exercise part of this, this is an important thing to take away. There are a number of studies, and all of the studies looking at things like Parkinson's disease. Parkinson's is a degenerative condition of the brain. What modifies the disease the most, what treats Parkinson's disease, prevents progression of Parkinson's disease, is exercise. It's not the pills or the deep brain stimulation or the surgeries or these sorts of things. Exercise and physical activity actually helps to preserve brain function in patients that have degenerative conditions of the brain. The same holds true with Alzheimer's disease. There's been 2 recent approvals of new Alzheimer's medications, but actually what influences the course with Alzheimer's disease more than anything else is physical activity. How you are moving and the amount of movement your body has influences the brain intimately. There's that same body and brain connection that we saw with the gut and brain. We don't know for brain tumors. There hasn't been a study done evaluating physical activity for brain tumors, but it is absolutely true that physical activity and your activity influences all 3 of those priorities for brain tumor care. The ability to treat the tumor, the minimizing of side effects, and the maximizing of quality of life. And so this is a critical part of integrating into your care. And you heard this morning about the importance of early physical activity after surgery, and that's something that we look to integrate into care all throughout the brain tumor kind of care continuum. A lot of patients come and ask, well, you know, can I get back out there? Can I take a walk? Can I go and run? Can I get in the pool? Can I do kind of aquatic therapy? The answer is yes, yes, and yes, making sure that we're mindful of the specifics to your condition and where you are into care. And so it is most likely true that exercise and physical activity influence the tumor that is there, but even more importantly is your mental well-being and just who you are as a person. Getting outside and being in nature and moving your body, helps all of the aspects of your care, and it actually does so all the way down to the genes. This is a fascinating slide that I'll spend just a minute on. This is looking at a number of genes related to inflammation. And this is 2 groups of patients. This top group of patients is patients who indicated that they were lonely. On a validated scale, really looking at loneliness. And the bottom is a group of patients who were not lonely. And there are different genes that are activated in the body of patients who report significant and severe loneliness than others. And those are genes related to inflammation and wound repair. And so who you are in touch with, the relationships that you are building, that important part of who you are as a person is influencing you and us down to our genes. The same is true for physical activity. We see the same thing with the stress response in physical activity, these same kind of changes to both inflammation-related genes and kind of wound repair. And this is just some of the way that we look at that in a graph. And so your physical activity is integral to not just your mental health, but the physical health all the way down to the basic molecules within the cells. So physical health is mental health. Mental health is integral to physical health. How do you do that? Light exercise, moderate exercise, heavy exercise. This is where we need to individualize it to the specific care of you. I love patients who are doing all of these kind of light exercise activities. And if we're there and doing well, we're looking to think about ballroom dancing. We just did a little bit of that. Always a nice spice to life. And really important, not just in that physical health, but mental health. But there are other ways to think about moderate exercise. When we get to vigorous exercise, this is an important conversation to have with your provider, whether that be the surgeon or the medical neuro-oncologist or the radiation oncologist, about what is right for you. But each of these are important, not just in terms of your physical health, but mental health. Exercise is critical. We'll stop for a question. I'm going to say one thing that gets your question. Exercise is critical for overall quality of life, but also minimizing side effects. Steroids is one of the most common medicines we use for treating symptoms from many brain tumors, and 75% of patients on steroids will develop a myopathy, weakness of the legs that causes difficulty with getting up out of a chair or rising. Weakness and physical activity is absolutely the most important preventive treatment for that. So this is a really important component of that holistic care.
You had said that there is no data linking exercise to brain tumors. Are you aware of any data linking exercise to other systemic tumors so that we can maybe draw some associations from that to the brain tumor?
In just about all the studies that have been done looking at exercise for managing side effects, some common side effects of cancer: chemotherapy-induced peripheral neuropathy, where there's damage to the nerves from chemo. Exercise prevents worsening and improves the patient's physical function and lessens symptoms. So time and time again, in looking at exercise, there's no doubt that it is an important part of care. It's just a part of what we do. The more active that we are as people and absolutely as patients, the better things tend to go. Part of this is about what's the right exercise for you at the time, for the patient at the time of their care. It's a great question. So we're going to end with a brief discussion of what to do when and what to ask, sort of what to do, when to do what and what to do when. And I want to briefly talk just about the epics of care, the continuum. This is how we think about it as providers, as cancer care providers. There's the prevention, early detection of a cancer, the diagnosis and treatment, the secondary prevention or monitoring for recurrence, management of recurrence and end of life. Those are some of the periods of time that we think about care of a patient. That's for a general cancer. It's a little bit different for brain tumors. It's very difficult, and in fact impossible in many respects, to prevent or early detect a brain tumor. We're also thinking about that early recognition with symptom onset. Often initial imaging is the method of an initial concern or diagnosis. Surgery is critical for just about every brain tumor. Invariably, we consider radiation, chemotherapy, and then recurrence. Those are some of the epics, the periods of time in glioma care. So what do we think about? What do I think about as a provider in each of those? Let's break them down. We'll start with initial diagnosis. This is an extremely difficult time for patients, for providers, and for caregivers. And often, the mind is full, and we really want to be mindful. And that is, I think, one of the most important things to be considering during this time. I counsel patients and families that I'm working with. This is really a time, I think, to avoid major changes. Is that the time to shift your diet? I think not. Is that the time to do a new physical activity? Maybe that's not the right time. But thinking about small tweaks to what has gotten you to where you are today that can help with that mindfulness, your presence in all aspects of your life, both in the clinic and outside of it, is what we're looking for. Rely on holistic interventions that you know things that you've thought about or incorporated already, and do what is right for you. That's the time to trust the things that you know and are a part of your life. Radiation, kind of the next step in that care. I'm going to fast forward because a few of these slides got animated strangely. But this is a time to be careful. So how does radiation work? Radiation works by damaging the DNA. And there's two ways that radiation does that. One is it just directly damages the DNA of the cancer. And cancer is growing, and that's how radiation targets the cancer cell. But the vast majority of radiation, the way it works is within the cancer cell, it creates this thing called an oxidant. It's about 85% of the way that radiation works. It damages, it causes a damage within the cell that creates these things called reactive oxygen species, and they go and damage the DNA. So that's a time to be really careful about antioxidants. Antioxidants can be very helpful in preventing cancer development, but once the cancer is there and we're using something that requires these oxidants, and antioxidants can reduce the effectiveness of radiation, we worry about that. So patients often come and say, I'm really interested in this, that, and the other supplement, and the key ingredient in that is an antioxidant. Radiation is not the time to incorporate that into their care. After the radiation and treatment has completed, that may be a time to integrate that supplement or nutrient into care. It's a great question. You know, the effect of radiation is really immediate. And so often radiation, the question was how far after radiation can you integrate those things? Typically after radiation, you'll see your a provider about a month after radiation therapy, and that's usually when we sit down and begin to have those conversations. So I say, let's wait till the scan a month after radiation, and then let's sit down and talk about what the right supplement is to incorporate at that time. Question?
What is an antioxidant?
So antioxidants are in almost everything that's out there, diet and a lot of supplements. And this is where Dr. Dunbar mentioned this morning. This is where asking a pharmacist or your provider to search whatever it is, the drug, the supplement, or the food, to look at how many antioxidants are in there is helpful. There's a whole list of things that function as an antioxidant. They're often things that reduce inflammation, that prevent cancer. We think of antioxidants for those purposes. So there are a number of substances that are common antioxidants. And sort of taking that list of things you're interested in. I'm interested in this supplement. I've been reading and looking at it. Is it an antioxidant? How much antioxidants? When should I take it? Is a good question to ask the team. During chemotherapy and surveillance, one issue that often comes up is this issue of scanxiety. And I see many just nodding their head. Right? I mean, this can just be absolutely debilitating. And a lot of the integrative approaches that we've talked about are really important for addressing that. We talked about how stress and anxiety influences your genes, the inflammation within the body, and finding what is right for you. And whether that be yoga or meditation or massage or a walk with your dog, or whomever, a companion, that is an important part of addressing these things. How to address anxiety is something we could talk for an hour on, but a lot of the treatments, the interventions, the thing we've talked about today can help support that. All right, the last kind of key item I wanted to hit on was post-treatment survivorship, and many of the things up here: supplements, cannabis, acupuncture, yoga, meditation, mindfulness, and virtual reality. We don't have time to talk about them all, and most of the questions come down to cannabis. And what do I do with this? And what is it? And hey, where do I get it? So, not going to answer the last one, but we can talk about cannabis as a substance. So cannabis is really a combination of two things. It is THC and CBD. Those are two different substances, chemicals, drugs. They're two different things that can be put in the body to alter the way the body works. We can put them together, and that's what cannabis is, or we can divide them apart and use them separately. And we use both of these products in medicine today. Dronabinol is a medicine that's approved, it's FDA approved, and it is a THC-based compound, THC-based agent, drug. And it's approved for treating nausea and vomiting in patients undergoing chemotherapy and for weight loss in patients with HIV. So we use THC in the clinic on a daily basis to manage these types of problems. CBD is also used regularly in medicine, and the medicine that is approved is called Epidiolex. Epidiolex is pure CBD. It is used to treat seizures, a number of childhood refractory seizure conditions, and it's very effective in managing seizures in certain pediatric populations. What we don't know is whether cannabis can be used to treat a brain tumor, or brain tumor side effects, or brain tumor patients with quality of life. And any provider in here probably has an experience with patients who have very favorable responses to THC or CBD, and then some patients who have a lot of side effects and drug-drug interactions and problems with liver function and other things that can happen with that. I love hearing from my patients that they're interested in THC or CBD and how they can integrate this into their care. And that question of who can help me understand whether this is a good idea for me and when and how to incorporate it is a very helpful question to ask your provider. So I'm going to end with do things that make you happy. And happiness is a state of activity. What was happening on the stage about 35 minutes ago was a lot of happiness in an activity. So that's a lot of what we're talking about with kind of holistic and integrative care, is how do you be an active person, an active participant in your care? This is where you get to take control. And I love seeing my patients taking control of managing their tumor in a way that works for them and it doesn't prevent some of the things that we know work to work. And so we spend a lot of time thinking about what is important to you, what do you want to incorporate in your care, and now let's find a way to do it safely where there's high benefit and low risk. So I'm going to stop there. I have a number of questions that often get raised to me, but before we get to those, I'm going to ask if you have any questions, and then with whatever time I can go through some of the common questions that come up. Any questions?
My husband, I have him on a THC CBD regimen. So now with hopefully the FDA going in to approve re-regulating cannabis off of a Schedule 1, which I don't understand because the FDA holds the patents for that, and yet it's still a Schedule 1, no medical use ever, dopey. How do we help? Do we just keep writing our Congress and representatives to support this, or how do we do this? Because I think it'll help us.
This is a phenomenal question. Thank you for asking it. And I think there were like 3 questions in there, so I love all 3 of them. One is, how do we as a field of medicine help to create a system where we can actually study this? In North Carolina, we are not allowed to study any THC-containing product, even studying it, to understand how it can be incorporated best into treatment, and that's true in a number of other states. Writing your congressperson and advocating for them to think about this is a very effective way to do that. Because how that will change is through legislation to allow medicine and oncology and cancer researchers to study that. So I actually applaud you for doing that, and I think that's an important way to allow the medical community to study it, because that's not the case in every state. The second question that you didn't ask, but I'm going to answer it anyway, is it a good question? So if it's not legal, will I get my doctor in trouble? And in North Carolina, I can't write any THC or really CBD-containing product. I can't write those. It's not legal to do so. Now, sometimes a patient will tell me that they have come into contact with a THC or CBD product, and so that just is what it is. Your provider, your physician isn't going to get in trouble for that. There's nothing illegal with your provider about that, and it's absolutely critical that I, as the provider, know what the patient is taking, and that includes medicines that I prescribe and medicines that they're taking, and really any other supplement that you know that they're incorporating into their care. There can be some interactions with both CBD and THC with other medications. One of the most common is a seizure drug interaction, a medicine called clobazam that can interact with CBD. And that includes even CBD that you would get in a hemp store or those sorts of things. So it's really important that your provider is aware of the things that you're taking, and they're not obligated to report anything. That's a part of the confidential patient and provider relationship, and there's no sort of legal concern with that. The third is what's right for you. And all of the things that we've talked about today are not right for everyone. And so this is a part of bringing those things that are a part of your goals and values into the clinic and the conversation, with your provider. Great question. Any other questions? So while you're thinking about other questions, I'll go through a few that are common ones that come up for me. The first one, does my doctor just want me to do their treatments? And I hear this a lot. I really think a lot differently. All of these treatments are our treatments. But there are some things that I know a whole lot about. And as a neuro-oncologist, I spend my whole life researching and understanding and really gaining experience with, so that I can help you to understand as a patient, or the patient who's in front of me to understand how this can be incorporated into their care. The dietitian I work with also has that same expertise about a lot of different tools. The physical therapist has the same expertise about a lot of different tools. The integrative medicine physician has a lot of different tools. They have that same expertise. You have a lot of expertise about things that you want to incorporate into your care. These are all our treatments. When you come to a provider, the first thing they think about is the tools that are in their head, and they may be missing the tool that is in your head. And they just want to know about it. And if they dismiss it, they just maybe didn't hear that question quite right, so just ask it again. And if they dismiss it, then they definitely didn't hear about it right, and so just ask it again. And I would encourage you to bring to your visit the symptoms and the treatments that are important to you, and ask each and every provider, who can help me to better understand how I can incorporate this into my care. Because that is absolutely why they are doing what they're doing. Sometimes we just don't hear it like that every time. They're all our treatments. So I want you to do all of our treatments. If it is important, won't my doctor just mention it? We should mention it all. But then, there's a 15-minute visit, and like Dr. Dunbar said, she's got 14 patients waiting for her. And so, it's just sometimes there are really, really important things that we don't bring into that visit, and I apologize for that, because we meant to do it. So please help us to bring that into the visit. These are all really good questions to bring to your provider. One suggestion that I might consider is to bring them in early. Dr. Dunbar mentioned the portal. You can use the portal if you want. You can not use the portal if you don't want. But bring in hey, here are the 3 things that I'm really important covering in today's visit at the very beginning is extremely helpful. And acknowledging to your provider, you may not be the best person to talk about these things, and if not, that's okay. Is there someone who I can meet with who can help me to address those? That agenda you said at the very beginning can be very, very helpful to ensure that it does get mentioned. Will my doctor reduce my cancer treatment if I complain of side effects? No patient complains, right? This is why I love that comment from Dr. Dunbar this morning. We want and expect you to bring your experience into the visit. We need you to let us know and your providers know your experience. It's a critical part of taking care of you. I will not reduce a treatment if it's not right to do. And I will absolutely do it if it's going to take the best care of the patient in front of me in any way. Shouldn't I just live with these symptoms so that my cancer can be treated? Absolutely not. We talked about the 3 goals of cancer care. It is to treat the tumor, but also to reduce the side effects and to improve quality of life. And all of that is really a part of the patient-centered care that we're moving. That's a priority. Can alternative or complementary treatments interfere or conflict with the traditional or conventional treatments? Absolutely. And if you could take anything away from that talk, I think this is the important thing to bring too. And that's That's really where we want the discussion being when you're with your provider is, this is what's important for me. These are the things I want to incorporate into my care. This is the information and data that you're bringing, and how do we put these two together in a way that's safe and effective? And oftentimes it starts to get at that timing. So if you're getting a challenging conversation, change that conversation to, okay, well, it sounds like now is not the right time. When is the right time for this treatment, intervention, or action? All right, happy to stay around and answer any questions that you may have. Thank you so much for being here and for listening.